You're listening to Body by Poly. I'm Dr. Alain Polynice, and this podcast is for anyone considering surgery and navigating all the complicated decisions to make before, after, or somewhere in between. Let's talk about what really matters. So, today we're going to be answering the question or the myth: do I need to exchange my breast implants every 10 years? That's a question I get asked all the time. So it's not a straightforward answer because there is no absolute need to exchange your implants at 10 years. Now, implants are very sturdy devices. I've had patients or women with implants for 10, 20, or more years who are having absolutely no issues or concerns with their implants, and they're perfectly fine. But the truth is that these are man-made devices and they're not designed to last a lifetime. And in essence, at about 10 to 12 years, if you're going to have an issue with your implants, it's probably right around that time. And by issue, I mean a concern with the implant displacement or rupture or capsular contracture. So now, when I have my consultation with my patients and I'm telling them what to expect with breast implants, I tell them that, these are very sturdy devices. They're going to last a very long time, but you should expect that at some point in your lifetime, you're going to have to do something with these implants, whether it's exchange them, revise them, or take them out. So it is preferable to do some kind of revision or an implant exchange before you have a major problem. So my recommendation is that at 10 to 12 years, yes, people should consider exchanging their implants, or definitely following up with their surgeon, making sure that everything's okay. And by making sure, I mean not only an examination, but also a study like an MRI that would really evaluate the implant and the tissues surrounding the implant to make sure that there's nothing going on with that implant. But now, as I go along in my career, and I've seen patients that I've done 10, 20, or 25 years ago that are having issues with their implants, my recommendation is to really be very diligent about following up with your surgeon and following up with your primary care surgeon or your breast surgeon to really have your implants evaluated, and then consider doing something at around the 10 or 12 year mark. Thanks for tuning in to Body by Poly. If you found this helpful, hit subscribe and follow along on YouTube, Apple Podcasts, or Spotify. See you next time.